Good afternoon. Thank you for joining today's QCDR webinar titled Making the Most of QCDR, Managing Physicians and Physician Group 10s. On today's call, I am joined by two of my colleagues, Priya Sharma and Jose Rios. In addition, we do have time allocated for clinical radiologists SC. They're based in Illinois, and they're going to share their QCDR experience. We are excited and send a special thank you to Chris Zuvenzek and Gretchen Maris for your participation in today's webinar. All attendees are in listen-only mode. If you do have questions throughout today's presentation, please send them using the question box located on the right-hand panel of your screen. We will go ahead and just jump right in and get started. What we will cover today is an overview of QCDR. We will talk about NRDR features, of course, of managing physicians and managing your Group 10. We will have clinical radiologists who will share their insights and how they use the QCDR. This is their first year participating. And then we'll pull it all together, looking at tips, resources, and key takeaways for facility administrators. Today's content is designed to be specific for those who have made the commitment to use ACR registries for PQRS reporting. So ACR registries have been approved by CMS to be a qualified clinical data registry. Essentially what this means is that every year annually we fill out an application with CMS to be a registry. And what that means is sites will send all of their data to us for their multiple physicians across multiple facilities, and then we will package that information for dissemination to CMS. We do have an entire web page dedicated to the QCDR. What measures are available, and any content that we discuss today has been made publicly available on this website. So let's look at why use a QCDR. Essentially, the QCDR supports both individual physicians and physician group practices in meeting the PQRS reporting requirements. Number one question we get now, we are in 2016, so we're focused on PQRS program, but in 2017 we will be transitioning to MIPS, or the Quality Payment Program, and these registries will be available to help you meet those reporting requirements in future years. Essentially, we will help you manage your submission of both PQRS and non-PQRS measures so that we can send them to CMS. When I say send them to CMS, we do this not quarterly, but once a year. So essentially, we are the data warehouse, and then March of every year is when we submit your data to CMS. So you do have time before that CMS submission to review your measures, make sure your data is accurate, and send us any additional information you want to display for CMS. Essentially, we do have two sets of measures, PQRS and non-PQRS measures. The non-PQRS measures are developed by ACR and more applicable to care radiologists provide. So if in the past, if you've done claims-based reporting, you do have an opening to report additional measures using our registry. I think the next few bullets, I don't have to read them out, but essentially will help you compile all your data needed and give you direct assistance from setting up, registering, and submitting your measure information that's complete and accurate. And then we give you feedback. The benefit of using our QCDR is that we give you real-time feedback. We give you feedback at least quarterly through our feedback reports. Each registry does have a feedback report, and QCDR participants have that as well. So before we start this call, I do want to get a poll of the audience just to figure out who we have on the line and determine whether or not you or your facility has made the commitment to use our QCDR for the current reporting year. Please indicate yes, no, or do not know. We'll allow the poll to be open for about 10 seconds.
Okay, so the results are in. We've got 55% yes, they are participating, 29% no, 16% don't know.
Okay. Thank you for that. That's why we want to get a sense of the audience and know, how we target our content so that we know who's participating. For those indicating that you are using our QCDR, you've been receiving most of our communications as far as some tips and tricks to make the best use of our system. For those who have indicated no, you're probably just trying to still learn about what it means to report via registries, because this is optional. The alternative is to continue doing claims reporting. But we do thank you for at least taking the time to gather that information, especially as we transition to a new quality program in 2017. And lastly, for the 16% who indicated that you do not know, through this presentation, you will see it's not too late if you decide to use our registries for PQRS reporting for 2016. Even though it's October, we are still accepting new registrations over the next, actually, 2 weeks. So now I think it's important that we look at, especially since we have people who are not sure about the registry yet, if we look at kind of our menu options of registries, we do have 5 different registries. They're housed under an umbrella called NRDR, National Radiology Data Registries. Each of these registries do have measures that can be used for PQRS reporting. In 2017, we are going to be setting a new registry for interventional radiologists. We are developing that, piloting that registry now with the Society for Interventional Radiologists. I did mention each of our registries does have measures that can be used for PQRS reporting. You see how many measures and for which database that's applied. You can see if you're participating in DIR and GRID or lung cancer screening, you have well over enough measures to meet the PQRS reporting requirements. I do want to highlight just on this slide, if you are participating in the NMD registry or the lung cancer screening registry, in order to get credit for those measures for 2016 reporting, you will have to give us data on 2 years worth of data. So participation does rely on data from 2015. 2015 is the first year where lung cancer screening became approved as coverage by CMS. And so do get us that information, because these measures do require a 12-month follow-up from your initial exam, so that's why we require, it's a little bit of extra information you need to know, but keep that in mind. So for the non-PQRS measures, we offer 24 measures that could be used for PQRS reporting. If you are doing claims reporting, these are not available to you and have not been unless you are signed up for the QCDR registry. Now that we looked at the measures, and it's just important to know, just make one more distinction that our participants in our registry are allowed to submit a combination of PQRS and the non-PQRS measures. For your reference, we commonly say claims-based measures and registry-specific measures. We have over 60 measures that can be used across these 2 different measure lists, so we did develop an Excel spreadsheet to help you figure out which measures are applicable to your radiologist. Essentially, in addition to the measures, as I mentioned, we have 5 different databases that has measures that can be used for PQRS reporting. So this slide is just to indicate that because we have separate measure lists, there are different data submission requirements. For our PQRS or claims-based measures, essentially we have provided templates on our website. You give them to your billing system or your company, and they can populate the template and upload your PQRS measures. And then data submission for the non-PQRS measures is dependent on which registry that you're participating in. You are not required to participate in all of the registries, just whichever ones help you meet the PQRS reporting requirements. Essentially, you see we collect data in 4 different ways. It could be manual. It could be an automated process. You can give us a data upload, upload it to our system, or you can use web services, and then you can see which registry supports. You'll see for lung cancer screening, there are multiple mechanisms of you getting the data to ACR. And then just as a reminder, if you are working with vendors such as Nuance or MagView, And even for our NMD, we have software vendors that you work with to help you send data directly to ACR for your PQRS measures. So do keep that in mind to reach out to your registry, your vendor contact, and make sure you let them know that you're using our registries for PQRS reporting, and they can assist you with data collection and exporting it to our system. So top of everyone's mind is it too late to participate? What happens if, I've signed up a few weeks ago? Is it too late to still participate in PQRS? Here on this slide is just outlining our process from our end date is March 31st of when we submit all of the data to CMS. But our start date, and at the top of everyone's mind because it's coming up, is our deadline for registering with our registries. If you are still making a decision of if you want to use a QCDR or not, we ask that you do that by October 31st. And essentially what that means is we do have to have a cutoff since we are collecting information from the top of the year, January 1. So we need to make sure we give you all enough time and don't have you kind of crunching a lot of numbers towards the end. And then we do ask, if possible, that you start submitting data to the ACR by this time. Not to worry if you're participating in more than one registry. If you have some data submitted for any of the registries, you will be considered successful and have met that October 31st deadline. And then I'll let you, everyone has this, we will make the slides available at the end of this presentation like we have with the past webinars. It'll be accessible, the webinar recording and the slides on our website. And then fees, let's just jump down to the March 1st deadline. If you are using our registry for PQRS reporting, we do have an additional fee of $199 per physician if you're an ACR member. And if they're not an ACR member, it would be $499 per physician per year. And that's even if you're doing group reporting, so keep that in mind. For this next slide, I'm just going to talk about the PQRS reporting requirements. Just this is a reminder that we do support both individual providers and we also support those who have indicated with CMS that they want to do group reporting via the G-Pro option. If you're individually reporting, it is 9 measures, 3 domains for at least 50% of all patients seen during the year. That all patients does extend its Medicare and non-Medicare patients. And if you're doing group reporting, everything is analyzed by CMS by your tax ID number. So if you have at least 9 measures across 3 domains for at least 50% of your group's patients, then you would have met the PQRS reporting requirements. And essentially what you're avoiding by participating in the program is you're avoiding anywhere from a -2 to -6% adjustment for not reporting. So keep that in mind. Your magic numbers are 9, 3. If you are group reporting, it's not each individual physician. It's across your entire group. I'm going to look at just our high-level QCDR process. For those who participate in our previous webinars, we do like to let you know that if you do want to use the QCDR, the starting point is you signing up for the NRDR registries. And part of how you make that determination is which measures do you feel your facility or your physician group is able to report. So first is looking at our available measures. We have over 60 measures, so you do not need to do all of them, just the ones that are relevant to you. The next step is that we do need to know what physicians will be participating or need to submit data to CMS. So we ask, our main function for handling that is manage physicians. And then we need to know your tax ID information. Which tax ID number do you bill for Medicare Part B services? That's the professional component. And then lastly, you would start submitting data to our registry, whether it's for PQRS measures. You do need to give the information to us, and we have templates. And if it's non-PQRS measures, you would follow the guidelines outlined for each registry. Each registry has data elements, specification manuals to help you walk through what's required. And just a caveat for all of this is that these steps right here is more for registration and account setup, so we do not expect your physicians to handle this information. When you sign up for a registry, we do ask that you identify a facility administrator, and they will be able to complete these steps and even submit data on behalf of the physician. So now I'm going to transition the presentation over, now that we did an overview of the measures, data submission, what are the reporting requirements. I think it's a good time for me to allow Jose to talk about our NRDR registration process, essentially, since that's what gets everything started if you want to use a QCDR.
Hi everyone, this is Jose Reyes. I just wanted to make sure that everyone's registration is correct. You may or may not have already set up your facilities, but so basically, if you haven't already, you'll have to go to our website, nrdr.acr.org, and you'll have to click New Facility Registration to set up your facility. If you only have one facility, you only have to do this once. But if you have more than two or more than that, you actually have to set up each facility independently. If you have two or more facilities, you'll have to create a master facility. It's a corporate account. It's going to allow us to link all your child facilities together and consolidate billing. And you'll only have to send the legal agreement once, and that's going to cover all your sites. So it's definitely going to be easier. If you're not sure if your locations are registered or if you wanted us to check your accounts, you just send us an email, nrdr@acr.org. We can definitely check that for you. You definitely want to make sure that each master and child accounts are registered for PQRS. So if you're not sure, you'll just log on. You'll click registration on the left-hand side, and then you can check the status of your registrations. When you click on that, you'll see a table. And if you don't see PQRS, that means your site has not registered yet for PQRS. And if you have not registered yet, you can, from that page, hit continue and check off PQRS and register. If you see PQRS, but there's a no under the accepted column, that means you have registered, but we're just waiting for a legal agreement from you guys. And again, if you're not sure, just let us know. We can send us an email or call us. We can check that for you very easily. So let us know. So after you've registered, you do have to send a participation agreement and BAA. So from the website, on the left-hand side, you just click participation agreement, and you can download a PDF. The best way for you to do is sign it and email it to us, and we can confirm your registrations. If you've already sent that to us and all you're doing is adding PQRS, you just have to send us an addendum. It's a one-page form. Again, email it to us, and we can confirm your registration. So for the fees, there is a registries fee. This is not PQRS. This is for the other registries, such as the lung cancer registry, the dose index registry. There's a $500 one-time registration fee, and then there is an annual fee based on your number of radiologists and locations. And please note, this invoice is just one per master account. So you'll only get one invoice, and that's going to cover all your sites. So it's actually going to come out cheaper if you have several sites and you have them all linked in the master account. And there is a PQRS fee. It's $199 per physician per year if they're an ACR member, and $499 if they're not a member. And just know that we do validate your physicians by NPI. They'll only be sent the invoice once. So even if you add them to several facilities, they're not going to be invoiced more than once.
Thank you, Jose, for that information. Registration is important, and if you do not see PQRS, that means in your registration tab, that means we do not have everything that we need to send your data on to CMS. Now I'm going to transition to Priya Sharma, who's going to give us some insight into managing your physicians and your text ID information.
Hello, this is Priya. So once you've registered, you're going to want to make sure that your physicians are enrolled in PQRS if you plan to submit for CMS. All physicians have to be added to each location, master and child site. And once you add your physicians, they're going to get an email with the login and password, and they'll only get one account no matter how many facilities they're signed up for. Once the physicians are added and they do get the email, they're going to have to go to the physician portal and confirm their account and accept that we will be submitting data for them. And I do definitely recommend using the download Excel template to upload your physicians list. It just makes it much easier if you have multiple locations, and just even if you have a large number of physicians. So to get to the managed physicians list, you would log into NRDR into your account, and from the left side menu, click on Manage Physicians. To get the download template, it's up at the top of the screen. I've highlighted here at the very top. If you are going to do a manual entry, I have a screenshot of what you're going to have to create. So you're going to create the physician's username. You'll select that you're enrolling them in PQRS, and you get to choose whether or not you're going to send the physician to the invoice to the physician or the facility administrator. The default is to the physician, so make sure that you click facility administrator. And I definitely do recommend using the template. If you're having any issues with it, you can always call or email NRDR. We can always take a look at the spreadsheet, help you figure that out, and upload it to all of your child sites if you include a list of those for us. And then once your physicians are added, you'll also have to make sure you add all your group TINs, which is another page. You would just go to the Managed Physician Group TIN on the left-hand side. You do have to put a date available from for your TIN once you're adding that. You do also have to upload a document where we can validate that this TIN is active and valid for your facility. The forms that you can upload for us are a submitted claim, a tax document, or another official document that includes your TIN. If you are participating in GPRO, you'll also check off GPRO when you're adding the TIN. And you also can select what registries and locations, all the child sites, all at the master level for where you want to add these TINs. And if you bill Medicare for more than one TIN, you can upload multiple TINs as well. And here's an example of what the Managed Physician Group TIN page looks like. And a lot of people think that up at the top where you see the Physician Group TIN and the GPRO, if you check off GPRO once, that the GPRO button will always be checked off. But you'll notice in the registry name and facility list, there's a column for GPRO where you will see the GPRO check mark and whether that TIN is associated with GPRO or not.
Thank you, Priya, for sharing those tips on how to manage physicians in your tax ID information. We do understand that most radiologists do read for multiple locations, and our system is sophisticated enough to capture all that information under one registry account. So do keep that in mind. So our top question is kind of after you signed up for the registries, you started submitting, data to the different registries or uploading your PQRS measures. How are the actual PQRS measures attributed to your physicians? We essentially use two magic numbers, the doctor's National Provider Identification Number, or NPI, and their tax ID number. And essentially, our system will allow the physician to see both PQRS and any non-PQRS measures that have been submitted for that physician. So if, for example, if you do have an account but you didn't enter your tax ID information, your feedback reports will not be available to you, and also you will not be able to see any measures for your physician. So keep that in mind. And then all measures can be viewed for each physician based on their NPI number through our PQRS physician portal. That physician portal pulls together, there's a tab called CMS Submission. It pulls together all the PQRS measures and any registry-based measures that will be attributed to that physician. Since we're also talking about, signing up correctly, and we have different registries, so we just put together a few tips to help you. If you have, from the top of the year, you've been submitting claims, and now you want to make that transition to registry reporting, do keep in mind that we will need all of your PQRS measure information for your patients dating from January 1, 2016 to December 31st. And we do have templates. Everything is publicly available on our QCDR website. If any sites on the line are participating in our grid registry that has measures that are related to turnaround times, we do ask that you submit your data at the exam level. It is required for PQRS participation. If you are submitting facility level information, we will not be able to send that information to CMS for your doctors. That registry does have 6 measures, so you want to make sure you have that exam level data. Just another reminder about the NMD and lung cancer screening registries, because they do have a 12-month follow-up requirement. We do ask that you give us 2 years worth of data in order to use the measures for 2016 reporting. And then our dose index registry is related to CT exams. It is required that you install your Triad software, and then most importantly, you do need to map your exams and your CT scanners. If any of those steps are incomplete, again, you would be your physicians would be affected by not having those 6 measures that can be used for reporting. And then as a reminder that for PQRS reporting, you do have to submit data for 50% of all patients. And if you're doing group reporting, it's 50% of your group patients. So just keep that in mind. I think now is a good time to transition. We did want to make sure we reach out to our sites who are actively participating with ACR staff and doing a lot of work internally to make use of the QCDR. So we wanted to share the experience. Special thanks to Clinical Radiologists of South Carolina. They are based in Illinois, and they are signed up to participate in PQRS as a G-Pro. They do have 75 radiologists, and they're servicing 31 hospitals. So as I mentioned earlier, our system is sophisticated enough to manage all of these different sites and physicians in one instance. And the registries that they're participating in is NMD, CTC, and then they do have PQRS measures that they will be submitting to our site. So Chris and Gretchen will turn the floor over to you. And on this slide, I did indicate who are 2 key roles if you do have a registry account with ACR. It's facility administrator and registry administrator. So when you hear them talk, kind of look for their perspective on what they can share. It's very different if you're a registry administrator or if you're a facility administrator, because you kind of have the golden power to do everything for your physician. And so I'll transition it over to them.
Hello, everyone. Thanks for the opportunity. This is Chris speaking. And I will say that Gretchen and I did a lot of the initial stuff together, so we experienced probably a combination of both roles because we went through the initial processes with some of that. But we opted to go with a G-Pro this year to help us meet the PQRS criteria because we're a large group and many of the radiologists are very defined subspecialties. And we were having trouble meeting the individual PQRS measures. So with our 75 radiologists and 31 organizations that we service, we decided that was the best approach for us. With that, one of the things that meant was that we had 1 master facility and we had 29 child facilities in our setup process. So I think Gretchen will talk on that a little bit on the challenges that brought along. We looked at a lot of different vendors. We're making our choice, but ACR's background to the radiologist was very helpful to us. The fact that they understood imaging and we could use some of the registries that were very specialized. So our initial enrollment process, we began working with Alicia and Jose right away due to the complications of having so many different sites and so many radiologists. And that was a little overwhelming initially, but we were able to work through that. They were very good about setting up a conference call for us to kind of walk through the process and make sure we understood. We had a couple of sites that along the way had already registered for the ACR because they were using some of the registries. So that was a little bit of a challenge because we wanted to be the parent facility so that we could see our information as a whole. So we had to work through some of those processes. Jose was great to help us reach out to those sites, explain the situation, and get those pieces so that we had unified reports. During the initial registration processes, I would say one of the things that we were not prepared for was the emails that go out to the radiologists. Once we set them up in the system and registered them, they started getting emails. And in retrospect, we would have better educated our doctors that this is what we're doing and why we had included them in those conversations. But they started getting emails and were kind of questioning, why am I getting this? What am I doing? What do I need to do with it? And so we would have been a little better had we have been a little more proactive, but we quickly shot out some messages to them, letting them know that they would be getting notified and what they would need to do with that. Gretchen, I'll let you talk for a minute.
All right, I'm going to go backwards for just a second and say that I think another one of the processes that we were excited about when we chose ACR was the fact that they had so many non-PQRS measures that would also qualify, because some of them are very unique, and I think that that's a big selling point in using ACR's QCDR for your process. Going back to the overwhelming part of the radiologist's emails, their solution was to create email rules that sent all of the emails to me. So I had a very full inbox for a long time, but it ended up working out very well. We were able to manage all of the physicians' usernames and passwords and help them out with their setup and their attestation so that they could be fully registered with the process. And moving forward, I think it worked out much better once we were able to settle them down and help them realize that, yes, they were going to get 30 emails for a username and password. So once we got past that, everything was much smoother. And then we moved on to the management of the tax identification number and the actual upload of the physician information with their MPIs and date of birth and things like that. So at that particular point, I contacted Jose and Alicia, and they immediately, got onto a webinar with me and walked me through all of it. I downloaded the template, we created a file for all of the physician information, and then started to upload that with our child facilities, and ran into a small snag with that, but Jose immediately stepped in and I sent it to him, and he was able to help out with that with all of our child facilities. So it was a very smooth transition, and without that, it would have been a struggle for us, because a file with 75 physicians uploading it 30 times kind of got a little convoluted. Once they were loaded, Alicia set us up, or walked me through the management of the 10, and she reviewed the rest of our account settings just to make sure that we had everything right. So at that particular point, I went on to start loading data into the different registries, and I chose the mammography database registry first because it seemed to me to be the easiest one to get my feet wet. We have mostly PenRed sites, we have a few MagView sites, so downloading the file through PenRed, creating the file and downloading it was very easy. One thing I will say is to make sure that you choose the option, if you are a PenRed site, not to put the header on the file, because when you upload it, it kicks it back as an error. So it's really good, though, that it tells you what the error is, and then you're able to correct it and re-upload it. So it's very smooth there. For my MagView sites, we have had a little bit more of a hiccup. One thing that we have realized is the MagView sites have to perform what they call a readiness review on the system data, which is a good thing. They look at all the data in the MagView systems, making sure that everything is there for it. But we did have a small hiccup at one site where the MPIs would not transfer into the download file, and the indication for examination field was not transferring either. It transferred them all as 9 unknown, which, according to ACR and CMS, is a proper response, but it doesn't allow the ACR to give reports back because it has no idea whether it's a screening or a diagnostic MAM. So I'm still working with one of my sites to correct that. But as far as the upload process, and I'll say it with all 3 of the registries that I've used, the upload process is very, very user-friendly, and I really like that. You upload the data, it tells you if it's accepted as long as you have a file that's under 200 records. If not, it tells you that you can check back at another time. It takes a little bit of extra time, but you can download a log file and tell exactly what is wrong with your data if there is a problem, and then you know exactly what to do to correct it and re-upload. The next one I worked with was the colonography registry, which is a manual process. So what we had to do was have our physicians go backwards and look at all of the colonographies that they had performed in the first part of the year, and then fill out the worksheet, which I think it took them a day. They kind of sat in a committee type thing and filled everything out, gave me the worksheets, and the first step on that one is to register the patient, which is a little bit different, but it's still very easy to do. Once you register the patient, you go into the data upload, and the way they've got it set up is exactly like the worksheet. So you just follow the worksheet down, enter the data, and submit it, and it's good to go. So that one is extremely easy to do. The PQRS one was the third one that I went to, and ours is a little bit different. We don't have an EHR, and our billing software doesn't capture all the information that is required for the data file. So in order to get all of the information, I worked with my head IT, and we merge both a file from our RIS and a file from our billing software so that we can get all of the required data elements, and then we split the file and upload it after that. As of right now, we have uploaded 3 data files for 3 measures, and then I have 2 more that I'm going to try to get done first of next week. But it has helped us figure out where we want to move forward in our organization as far as our billing software, so that's a good thing. The only 2 takeaways I have from any of this that would be even considered a negative, and they're not really a negative, would be the data issue. When you're uploading data, I did find that you have to be logged in. You have to be the facility administrator to upload the data. So Chris's login has to be used for that. But I understand that ACR is in the process of correcting that very quickly so that registry administrators will be able to upload data to PQRS. And then the breakdown of the files into single physicians, but again, they're correcting that too, and we'll be able, I believe, Alicia, you said that it's very quickly going to be a group file that we can do, that we can include multiple doctors. So other than that, I have absolutely had no issues dealing with the process. I've had no issues dealing with having a problem and getting it resolved. And kudos to Alicia and Jose and Lou Meyer and Corey O'Brien for helping. Chris, do you have anything else you'd add?
I don't believe so. I do think going to the ACR was a good choice for us because of the specificity with the imaging, and it has been helpful, particularly with the groups that have the interface, or not the interfaces, but the automatic uploads. So with the National MAM database, that has been very helpful. But we're happy to answer any questions that we can share in regards to our experience.
Thank you both to Chris and Gretchen for sharing your experience. We welcome all feedback, good and bad. We do appreciate you sharing your experience of what you have to do internally to get us the required data. I and thank you for Gretchen for pointing out, we do understand that it is hard to kind of have one file per physician, especially with us 2016 being the first year where we support the G-Pros. So our IT is working diligently to allow all sites, at least for uploading your PQRS measures, to give us all physicians in one Excel file or text file. I'm told that should be ready in about a week. I know we've had some verbiage on our website saying that it was coming soon, but you can imagine the amount of data for all of the patients and then for all of the physicians all in one file. So we are working to troubleshoot that. And then also, we just have a few more slides. So I think if the audience has questions for Gretchen and Chris, we can go ahead and save those to the end. We'll go ahead and address those. We just have about a few more slides, 2 or 3, that we'll get to, and then we'll open the line up for question and answer. We should have about 15 minutes or more for questions. So please do send those through the question chat box. And again, as Gretchen and Chris mentioned, the ACR staff is here. I mean, sometimes we do get several calls and several emails, but we are here to do one-on-one to look at your profiles and kind of consult you on what to do next. So we don't want to leave anyone just guessing how to use the system. Part of the QCDR, as I mentioned, is the feedback component. We do submit feedback. We have quarterly reports that we submit to all registry participants, and each registry has their own feedback report. So most of you on the line, if you participated in PQRS for 2015, CMS just started notifying about 2 weeks ago of whether or not the provider was successful in meeting all the measure requirements. If they were not successful, it's really a late time to tell you because we're almost wrapping up 2016. So if you use the QCDR, you do get that real-time feedback. Our next feedback report will be issued sometime in November, and that'll be for data submitted between July and September. If you do not submit any data to our registries, then you won't be able to make use of the feedback report. And actually, as I mentioned, this is a QCDR webinar series. Our next webinar series is going to look at Q3 data and kind of walk you through how to retrieve reports and what you should be looking for. We do have an entire website dedicated to the QCDR. Yes, we have a website also for our NRDR registries, but if you want to do QCDR, it's with the goal of submitting your data to CMS. So we do have additional reporting requirements. We make available under how to submit data is where all those templates are that we reference. The cost information, everything you need is here. And then as a reference guide, because this is a complicated process, and if you're trying to figure it out or you're like, where do I start? We do have a 3- or 4-page document that is to serve as a participation checklist. So the first step, of course, is getting registered for NRDR, and then you'll see information about participation agreements, and we have user guides and manuals to walk you through each of the processes. And we do ask, even if you did participate in our registries in previous years, because we've been a QCDR since 2014, do make use of that QCDR participation checklist because you want to check your physicians, make sure we got your tax ID information in the right places. And then just a few takeaways from today. You can see from the call that facility administrators are core to successful participation in the registries. We do ask that you add your physicians and 10 information so measures can be attributed to your physicians. If any of these fields are blank in your NRDR account, we will be unable to generate the feedback report, and we won't be able to, you won't be able to see the measures displayed for your physicians in the portal. And then familiarize yourself with the different data submission methods. It depends on which registry you're participating in. If you are a site that's only participating in 2 of the 5 registries, then that's easy. But if you are participating in almost all of the registries, which we do have a lot of sites do that, be careful to make sure that you know what data is required and how to submit it. And then if you are still deciding, there is time to participate or make changes to your account if you notice that, hey, I missed that physician group 10 page, or I forgot to tell ACR that I am a group I do want to participate as a group, especially if you're doing group reporting, the requirements are different and simplified. Your deadline to make all these decisions is October 31st. We have been sending blast communications to our NRDR registry participants and have everything posted on our website, but we do realize that there's some internal discussions that have to be had on who controls data, and so if you're still making that decision, you have until October 31st. And then lastly, I just posted kind of our next series of webinars that are coming up. If you participate in our previous webinars, we try to make them as interactive as possible, and they are very topic specific, but if you do have suggestions on future topics or more that you want to get out of these webinars as far as sharing your experience, just feel free to send me an email and we can add that in. I know our IT folks do want to do their own webinar dedicated, but our next one is November 10th, and you can register for any of these today. We'll look at our Q3. Even if the Q3 feedback reports are not available, we can at least go through the key features. And I think we'll go ahead and open it up for questions. We have about 15 minutes, and here's our contact information. Like I said, we do have a hotline, so we have only 3 options. So if you get option 3, you'll get me. If you select option 1, you'll get Priya and Jose and others. And in option 2, you'll get Victoria O'Brien or Lou Meyer. So we are a team here. We are trying to divide and conquer this process. So do we have any questions in the queue that are unanswered?
Yeah, the first one we have is actually for Chris and Gretchen.
Okay.
So this is for you guys. Clinical Radiologist SC mentioned moving forward with billing software. Can you share current and/or future billing software and features that you're either using or looking to get?
I will be honest, I cannot share where we're going with the future because we haven't narrowed that down completely yet. But what we are looking for is software that when the coders are putting the codes in and they have to put the extension for the PQRS modifier, it will require them to enter that information, and there's no way to skip that process. We're also looking for something that provides a little bit more user-friendly data and information. So our current system, things like, and some of this is set up and not necessarily the flaw in the system, but simple things like patient identifiers. Gretchen, you might be able to speak on some of the other information. Doesn't come through in the interface.
Right. The biggest problem is the CPT2 codes are shared in the same field as the CPT codes. That's the biggest problem. And we're not sure. I mean, I don't know if that was a setup on our end or a setup on their end, but so in the case of a screening mammogram, you have a CPT code for the screening mammogram and a CPT2 code for the reminder system, but those come out as 2 separate lines, 2 separate entries, rather than one entry with a CPT2 code for the denominator or for the numerator. So that's the biggest problem.
Thank you. Our next question is, if a non-PQRS measure is eligible to also be used as a PQI project for ABR MOC, how does that work?
For reference for this call, we would ask you to send that questions to nrdr@acr.org, and our staff will be able to address how to get started with that. Each of the registries are approved to be a PQI project, under as Maintenance of Certification Part 4. So go ahead, we can get you paperwork on how to get started with that if you're interested.
Next question is, for which registries do you have to submit data on all payers versus just the Medicare population?
So with our QCDR, it's mandated by the government that all of our registries collect both Medicare and non-Medicare patient data. That's for 2016 reporting, and even for 2017 reporting under the new quality payment program, they are switching to mandate that all registries submit all payer data. So right now it's not specific to one registry, but all registries.
Next question is along the same lines. Currently, we submit our PQRS measures via claims and only for Medicare business. However, you mentioned at one point reporting 50% of all patients. Can you further explain?
Yeah, so that kind of piggybacking on my last response is for the CMS measures, yes, traditionally it has just been Medicare Part B, but we are mandated by CMS to collect all payer data. So what that does mean for sites on the call today is you would have to go back to your private payers and recode those claims. And Gretchen and Chris, feel free to jump in if you've had to do that. If you've on that process, I know it's not as easy as I'm making it sound. It's a little bit of a burden. But all patients will be considered in your reporting rate and your performance rate for any PQRS measure.
Okay. The next question is, I believe, for Priya and Jose, maybe. If you initially put down a wrong start date for your TIN related to your registries chosen, how do you go in to remove the wrong TIN start date and have it hold on to the correct TIN start date? Does the NRDR system take 24 hours to update?
The system won't delete TINs, but you can re-enter the TIN with the correct start date.
So as you make changes, as you add that TIN again, just change the start date, and the end date field is not required, and then just make sure you add and save those changes. And then your table will populate. You'll have the TIN with the incorrect date, and you'll have the TIN with the correct date because we don't delete anything from our system.
Okay. Next question. To report as a group for 2016, you needed to elect to do so by the end of June, correct? To switch from individual to GPRO for 2017, when can you do that?
So the final rule for the 2017 program was just released today, and I haven't had it's actually 2,400 pages worth of content. Group reporting will be available for 2017. I am unsure of the exact deadline at this moment. But just know that you will have an opportunity to select individual or group reporting under the new quality payment program. And the final rule is out today. If anyone, go to cms.gov and you can download it and read it over the weekend if you have time.
Some light weekend reading. This next one is the last one we have right now, so if anybody else has questions, feel free to go ahead and either type them into the question box, or you can raise your hand with the little hand icon, and we can unmute you and you can talk to us. So this last question is, just to clarify, if we successfully reported 9 measures across 3 domains and 2 patient outcomes for only 1 physician for at least 50% of total patients seen by the practice, would we successfully meet the PQRS requirements if we are reporting as a GPRO? So just one physician, but they're reporting as a GPRO.
That's a great question. You would not be successful. CMS defines a group as 2 or more providers billing the same tax ID number. So you would have needed to do individual reporting if you only had 1 physician. So it's really 2 or more for GPRO.
Oh, I wonder if she was asking,
Only
she has multiple physicians, but only 1 physician submitted and submitted the full requirement.
That would count for them.
And she says yes, that is what she was asking.
Okay, so then you would meet the reporting requirement. I'm about to say only 1 physician, that's not really a group. Sorry about that. It's a little late on a Friday afternoon. Sorry about that. So yes, because how GPRO simplifies reporting is you safeguard any physicians who were unable to report any of the PQRS measures.
Okay. Thanks for clarifying.
Do we have any hands raised?
Okay, we just got a new question.
Okay.
We have 8 providers submitting claims based for 2016. Our IR radiologists did not successfully meet the requirements, but the rest did. How are we impacted?
So because you're doing individual reporting for 2016, part of claims, there's a process. If you do claims, there's additional reporting requirement that's not available to our QCDR participants. That reporting requirement is that if you have any providers, such as your IR doctors, if they have any patient face-to-face, if they have face-to-face encounters with any of the patients, that means they would have billed an E&M visit, they would be required to report at least one cross-cutting measure. It sounds like your IR doctors would not be successful if they didn't bill for that cross-cutting measure, if they didn't select that cross-cutting measure for billing. And because you're doing individual, your other providers are safeguarded from the penalty, but your IR doctors would not. Feel free. I recommend, even if you agree with the determination or disagree with the determination, feel free to submit an informal review using the CMS portal, and you can have CMS, the help desk, kind of look into it further, whether or not your IR doctors should be deemed successful. And you have to do the informal review by November 30th. It's the cutoff.
We do have a hand raised here. Looks like it's Heather Emery. So Heather, I'm about to oh, never mind. Just put it down, I think. So the next question we have is, if you are reporting out 2016 information for PQRS, how do you do that when your submission is due October 31st?
So October 31st is not the submission deadline. Our submission deadline is December 31st for the dose index registry and January 31st for all other registries and PQRS measures. Just to clarify, the October 31 deadline is if you are new to using NRDR registries for PQRS reports, only if you're not signed up for NRDR in any way.
So that goes along with her follow-up question, which is it too late to switch if you've not used QCDR in the past? So, no, she can still do that for the next 2 weeks.
Yeah, you still have about 2 weeks to go ahead and when you create your NRDR account, we'll give you a 6-digit facility ID number. Check PQRS, it takes you less than 2 minutes, and then we can go ahead and work on agreements and stuff after October 31st.
We've got 2 more questions here. Would you please explain how a large radiology group can establish their account as the parent site when they do not own any of the facilities that they provide services to, especially if these facilities already have established registries?
I think what's best is if you send us an email with all your facility IDs, just so that we can check your account, and then we'll work on your specific case of how to link your facility as a parent master facility to those child facilities. So just send us an email, please.
And a lot of the time, hospitals will give radiology groups kind of permission to piggyback off the accounts that are already set up for PQRS reporting, because they're using the physicians from your radiology group. So generally, that information is already in the system, and it would just be doing a few more extra steps for them. And a lot of the time, they will add you as a user so that you're able to do the work on those sites.
Okay. The next question, 2 from the same person here. Is the informal review from CMS only for PQRS submission, or is it for both EHR and PQRS measures?
I believe it's just for PQRS measures. There's probably a separate process for EHR because that's another program called Meaningful Use. And right now the programs aren't aligned. PQRS is separate, Meaningful Use is separate, and if you're in the shared savings program, that's a separate, they all have separate requirements. So the informal review that I mentioned is for PQRS measures.
And a follow-up question. We currently use the ACR QCDR for PQRS submission. How will this transition into MIPS for 2017?
So the final rule is out, and I'll have more information, but essentially the QCDR is a mechanism to allow groups and physicians to meet the new, there's 3 different performance categories. Essentially, all the measures that you're reporting for 2016 will be available for reporting in 2017, so you won't do anything different for the quality performance category. Right now, the requirements are going to be simplified for 2017. Instead of 9 measures across 3 domains, you're going to only have to do 6 total measures, and one of those measures must be an outcome. We'll have more information about the reporting threshold, because I think in the proposed rule it was somewhere like 90% of patients have to be reported on, and we have to check and see if that's finalized.
Okay, one last question here. Does meeting requirements for PQRS apply to data submitted per child facility, or is it across the board due to 10 NPI submissions? Across the board due to 10 and NPI. CMS is not aware of your different facility IDs in any way. That's more internal for our NRDR structure. But if you have the 10 and the NPI, you just need to work with, if you have multiple sites, work with each of the facility administrators to make sure your physicians are accounted for, and you should be successful. We do, when we get closer, like I said, January is the deadline of getting all the data in, and in January and February, we will work with you. Each of the facility administrators will send you a spreadsheet of how many measures you have, how many domains, if you're meeting the reporting thresholds, et cetera. So we do have ongoing communication prior to our March 31st deadline to CMS. So you can make any changes to measures, unselect measures that you don't want CMS to see. We leave the discretion of that up to the physicians or your facility administrators to determine what you want to submit to CMS. I think that's it. We're actually over time. Thank you to all for being active and engaged on this Friday afternoon. We will post a recording in the presentation slides for your viewing. And special thanks to Chris and Gretchen for sharing your experience. And we will, as changes are made to the system, as that new template becomes available for G-Pros and also others participating in the registry, we'll send that via email so that everyone is aware. Thank you for your time. Thank you.